So today I interviewed Dr. Lim from Vielight. Now Vielight is a company that specializes in medical grade photobiomodulation devices. Their products are highly regarded when it comes to resolving brain disorders and just helping with cognitive function. We cover a lot of topics in today's call, everything from the company's history to some of the amazing published research showing how their products are beneficial for numerous brain disorders. We talk about power density, looking at the ideal range for treatment. We look at potential side effects of red light therapy on the brain, and also cover whether red light therapy on the brain or in the head could actually lead to downsides. All of that plus a lot more is covered in this interview. Now I do need to mention that Dr. Lim was actually on a personal holiday while he did this call. We were trying to line up a date to take a deep dive into some of the research around photobiomodulation and the Vielight company, but our schedules were all over the place, so we decided to jump in, do this first call, and we're going to do another one later on in the year or maybe early next year. So I'm super appreciative for Dr. Lim and his time, and I hope you guys get a lot from this interview. Okay, thank you so much for taking the time out of your personal holiday, Lou. I really do appreciate it. I'm going to be conscious of your time, and we're going to dive straight into the questions. Now, first up, I need to ask: is it Vielight or Vielight? How do you pronounce it?
V actually stands for life in French.
Oh.
We adopted that, and so it's a hybrid of French and English word. So strictly speaking, is Vielight.
Vielight. Well, there we go.
I know we always get called Vielight. That's not a problem either.
Yeah, it's something I've always wanted to know what the correct way was. So there we go. Can you give the audience a quick rundown of the history of the company and your involvement?
I actually got into it was at a time low level laser therapy, and it's around the mid 1990s when this space was mainly in the realm of the Soviet bloc. At that time, most of the literature that came out, I would say that great literature, were in Russian. And I was living and working in the Silicon Valley at the time in California. So we played around with laser, flat panel displays, and a bunch of things, and just came across this. And at that time, this photobiomodulation or laser therapy at the time started, as you probably know, around 1967. It went on and on. It's mainly in the realm of the Soviet bloc. And then by that time, they were injecting red light into the vein, and found that actually it improves blood property. And I thought, hey, light can actually penetrate the skin, so why do things like that? And experimented and found that if we, it works. And so I figured out, okay, what is the thinnest membrane between air and your body is, and I think you can draw the conclusion actually is in the nose, where the membrane is really thin, just rich capillaries. And I found that by doing that, you can get very similar results because we actually use microscopy to look at the changes in the red blood cell aggregation and stuff like that. So that's where we started. Intranasal, we commercialized. It took us a while because I was waiting for the technology, the solid state technology, to progress from really, these bulky lasers to diodes, solid state. And we started commercializing in the mid 2000s, and I hold a patent for it.
And you founded it. This is your company.
Yeah.
Very cool. So now you've got all these headsets as well, right? So have you moved away from simply blood irradiation, like full body systemic benefits, and now going for more of a target approach with those headsets? Or does it depend on the goal as to what product you're using?
Yeah, no, everything we do, I'm speaking on behalf of the company, is based on science and evidence. So we try to remove guesswork as much as possible. Now, we have placements of diodes and laser, everything, and everything is done for a reason. Now, we started with the nasal, and then I thought, okay, it's working for the blood. How about irradiating the brain from the nose? So we use a near infrared, which has a longer wavelength and it reaches the brain. And now we're saying, okay, we're getting good outcomes. And then I actually filed a patent for that aspect of it as well. So now from the blood, systemic, now we're going to the brain. So that works. And now we say, okay, how about enhancing it further by directing more from the head? And that's where we develop the neurals, and that actually enhances it further. Now we have a combination of nasal, which I think personally is the most important source of treatment for the brain, and now with the head. And I would say that it's proving out in a number of studies that we do, a lot of feedback from people which we don't actually take the trouble to put much on the internet, if at all. But what is important to me is do objective measures, go ahead and test on people, but do in a controlled manner. So while in the meantime, I'm talking kind of medical here, but all the devices are considered low risk general wellness devices, which means that FDA allows us to put it out there, but we don't make a medical claim until we get, FDA to clear those. So we're starting to get clearance from Health Canada and FDA. We've gone into big clinical trials. It takes a while to get that kind of evidence. So that's how we know that's what our general philosophy is. Don't just go do a bunch of marketing and get panels and push it there just because you read, here and there. The red light therapy is the insane, whatever it is. We do everything we can and as much precision as possible. If you have time, I'll talk about the future, but that's where we are right now. I don't know if you're familiar, but while we're talking, I don't want the audience to not understand while we're talking about photobiomodulation and light therapy. This is our one example, and this is our latest version in 04. So it's not different in the way it treats functionally, but now we recognize that as we grow and we continue to improve. There was some discomfort on the older one, but this new one is completely comfortable. It's still, just put over your head like this. Walk it down. I'm trying to align it. Okay. That is it. And one goes to the nose. There you go.
Oh, that's cool. So they're attached.
Yeah. And so this is actually not officially announced yet, but your audience, if they're, but we will announce it pretty soon. But if your audience is interested, go through you get the latest version for this. And we have a choice of pulsing between alpha and gamma by pressing a button. And the new one actually has one more to the back of the head, to the cerebellum.
Right.
Apart from the points to the default mode network.
Okay, I have so many questions here. The pulsing, is that incorporated from a brain entrainment point of view, or is it more to help deliver the light? Is it using really high intensity LEDs, lasers, so you can push the light in further without heat buildup? What's the rationale behind the pulsing?
So the idea really is to two most common state that a lot of neuroscientists try to achieve is to get the alpha state or a gamma state. And the alpha state is kind of like you're maintaining your brain when you're resting and do some introspection, not doing a task, you're in the default mode network state. And this is where your brain tries to, consolidate stuff and try to heal itself and so on. Then, if your default mode network is in a good state, generally your brain is in good health. Now, we do gamma because if you have endogenous gamma in your brain, which is, largely the discussion is around 40 times a second, 40 hertz, your brain will probably be functioning at a higher level. So we take this information and say, okay, let's try to get the brain to achieve it. And it's not necessarily in training, it is the process of while this is happening to get your brain in that state, you are doing this is doing a lot, some physiological modifications in your brain or modulation to your brain to reach that. That's just, and we found really good, interesting results. Our devices are now actually being sought after by elite athletes and sportsmen. I've got reports of really quite significant and measurable enhancements of their performance in competition. So that's we can go into more details, but we can talk about the science another day.
Yeah. So, well, real quick on that athlete example, are these athletes who are doing cognitive intensive sports, I don't know, a skill-based sport, or is it just power performance output improvements you're seeing?
It is right across the spectrum. We have triathletes, we have MMA fighters, professional tennis players, Olympic skiers, on Olympic judo. We have strengths, what I call power lifters and strength performers. Yeah. So it's right across the board. Now the thing is, here's the protocol that we have for them is to use now the duo. So this particular device that we have, you can switch between, like say, the duo. There's a button here. You can switch between alpha and gamma, and I would propose to them to say get your brain at a higher state before the events like a competition or training, so your brain makes better decision, is function. When you have endogenous gamma, it does a lot of things. It doesn't just apply to athletes. It applies to you taking an exam or before public speaking events or whatever it is. So we get it, and then so hopefully, and I find that in many cases it happens, the athletes do perform better. Now, after this thing is over and you're recovering, I would say anytime after that, switch to alpha. When you're resting and your brain, it helps you to consolidate what you've learned. So that's my protocol in general with the neural duo for athletes and the performers. And so far seems to work. And we will be putting this to test also, in terms of measurable performance too.
Yeah, that's fascinating. I've seen some of the studies or some of the case studies you've published, especially with the NHL athletes. But yeah, I mean, to hear that the powerlifters and triathletes as well are getting benefits where it's just more, a repetitive movement, and they get benefits is huge.
Yeah, one of the things that I think is happening too among, let's say, professional football players, they have, a lot of impact on the brain. And what I'm talking about is, this is also applicable to the military, where they do not just when they're on the tours, but even in training, they undergo a lot of, minor traumatic and brain injury. You don't feel it. Yeah. When you go to, blast in your training, that some kind of minor trauma is going to happen in your brain. So that is cumulative. Now, for professional football players and ice hockey players, it's going to be more profound. And there is, there's a lot of discussion about retired American football players who have lost their cognition, going on a decline. They lost control of their functions. Then they have suicidal ideation. Yeah. So that is to do with an advanced stage in CTE after repetitive traumatic brain injury. Now I find that even though you're an athlete, you're like in this kind of contact sports, you may not feel anything. And one of the reasons that you improve with this is probably not possibly likely that your brain is healing from this trauma, cumulative trauma. You don't realize it, but once you're healing from that, you actually perform better. In fact, I expect to get better results from athletes who are in combat or contact sports, like MMA and boxing and American football players, rugby players, whatever.
Hey, so I hope you're enjoying this video. Please hit the like button if you are, and also while you're down there, hit subscribe. I'm going to be doing some reviews of the Vielight products, plus I'm going to do a round 2 interview in the coming months. So for someone listening who may not be up to speed with red light therapy, photobiomodulation, but I've heard good things about it, particularly the brain side of things when it comes to the brain benefits when it comes to your product. Can you give them a quick overview? Like, how is shining a light, sometimes an invisible light with the near infrared range, how is that creating all of these benefits? Likewise with putting it up your nose. Can you just give them quickly a rundown without getting too technical, I suppose?
So here is the established fundamental mechanisms, and I expect that the people you interview from this world of photobiomodulation will be telling you the effect on the mitochondria, the electron transport chain in the mitochondria that's responsible for producing your cellular energy and stuff like that.
Right.
In that, you receive the red and the infrared light and get energized. But one of the things it does is it's not just more cellular energy. You actually activate gene transcription factors that affect a number of things. It gets the body into a better balance of homeostasis. It accelerate the healing process. It actually it's been found to produce growth factors, which means that these factors help your body and your brain to heal faster. It releases nitric oxide to improve circulation and so on. So that's kind of the fundamental. Now, I am in the process of co-writing a study that I hope will be published in the next few months. That we discovered using a technique called Raman spectroscopy and see what's happening to the proteins in the neurons. And I found that this is photobiomodulation, the way we do it, is able to even rejuvenate the microtubules in your brain. The microtubules are, these protein structures that support the integrity of the cells. It gets into this state where the process seems to kind of, remodel or refresh these structures too. And that relates to keeping your brain young because you're refreshing your microtubules all the time. I think when this paper comes out, it's going to be really interesting. Now, this is a completely new discovery. No one's done it. And one of the things that we do, bring new. Yeah.
I'm excited to see the paper, and I'll be sure to take a deep dive into it. Maybe when it is out, that would be a good time to do a follow-up call, and we can go into some more of that science. But it is, it's funny because you're typically hearing about the mitochondria, cytochromes deoxidase, and all of that. But then, for instance, after speaking to James Carroll a few weeks or months ago, he even said, like, there is just so much we don't know. Like, there's mechanisms of action here that we still haven't discovered, and it's amazing because there are hundreds, thousands of papers on this the technology, on the science around this, but there's still so much we don't know.
I tell you what we're doing. It's true. The more we discover, and I say that Vielight, my team and our collaborators, are at the cutting edge of understanding what's happening to the brain and to some extent the immune system. You're right. The more we know, the more we realize we don't know. We're kind of like opening a door, and we see this big light at the end of the hall, and there are many paths there. So now what we are doing is try to understand this further and then personalize it. So we are now incorporating artificial intelligence in what we do, because then your this whole process would be able to take in the information, say from EEG, and try to shift it, shift your brain to a level that we want through, you keep doing this loop and try to improve it. So that is starting. I actually hold the patent for this idea of introducing artificial intelligence into photobiomodulation. And I'm very, very excited. Now, the other things we see is, I don't want to go the deep dive into the science, but what we find is that, is how the brain is responding to photobiomodulation is quite remarkable. Mm-hmm. It goes into suddenly, it just explode into a total brain response, And we're doing this with the scientists with Beckrest Hospital in Toronto using this big MRI scanner to do it. Now we will continue to learn more, but I'm very excited because here again we are at the cutting edge, doing this real time and seeing what's happening to your brain in real time, and then try to personalize and refine it further. But in the meantime, our philosophy is always to offer products that are easy, simple to use, and to be used at home, and hopefully affordable. So that is the ultimate goal, and not to make, you have to go to special rooms or whatever to get this outcomes.
Yeah, the real-time feedback, the EEGs or QEEGs, and seeing what's changing. And like you said, coming in and my son suffers from epilepsy, right? So I've got a bit of an understanding just over the years, researching his condition, and speaking to various doctors. And
what's he suffering from?
Epilepsy.
Epilepsy, okay.
Yeah. So like recently, so he's actually going through a program with Dr. Beck. I'm not too sure if you're familiar with him, but yeah, we're doing monthly QEEG scans, and I've learned a lot more about brain disorders and imbalances and that. And yeah, he's coming in and trying to balance things out because there were some severe imbalances. So now when I think about what's happening with Thomas on a 6 to 9 month time frame, I think, wow, yeah, eventually if you could have that device measuring the brain and then pulsing the light, feeding the light into the areas that need that stimulus, it's opens up a whole new world of possibilities when it comes to brain disorders.
Yeah, actually, there could be a role for photobiomodulation in helping with epilepsy. There is quite a lot of work done at University of California, San Francisco, showing that as you increase the endogenous gamma in your brain, the risk of seizure is reduced. Mm-hmm. So it is something that I've been working on. But it takes quite a while to be able to get the brain to have endogenous gamma, and we will be using artificial intelligence to try and do that.
Yeah, it's very cool. I have looked at quite a few of the studies on it, and I have seen how promising it is. So that's why we are working with these doctors who are using it in their protocols. And we're having good results. Like his most recent scan came through showing tremendous improvement. But I don't want to spend too much about my son or epilepsy. I want to go back to the brain disorders. Okay, so you've touched on quite a few benefits already for athletes and just average Joe. But let's say someone does have early onset Alzheimer's or dementia, or some issue that is becoming a concern. What should they do? I mean, is it as simple as saying just buy this product and use it every day, or do you work them through EEG scans? Is there a process in place there, or is it just get light into the brain and it's going to help?
Okay, I'm not going to make like an outright claim here because it's not going to be I got to contain myself, but I'll point to the clinical trials that are out there using photobiomodulation. We were actually the first to do a clinical study using photobiomodulation to treat dementia and Alzheimer's patients. And I go back to even before the clinical trials, right, we had in the neuro. I go back to like 2010 or 2011, right, just the intranasal case. I actually presented this in the Alzheimer's conference. Well, one case where a Dutch immigrant in Vancouver area in British Columbia. He runs in his family. His siblings hit a certain age, and it's like clockwork to get into Alzheimer's. And then the daughter, contacted me, and they were desperate because he was declining, and we used a intranasal. At that time, that's all I had, the intranasal, and he actually seems to recover. When he was starting to forget the families, the names of his children, he was starting to remember, and like symptoms like at some stage, Alzheimer's patients keep away from social settings because it's kind of observed to them. Yeah. He was starting to engage again. So today, after more than 10 years, he's still doing fine. He's like all these neurons. So that was a published case, and we had a study that we had over four patients with even a couple of them in severe state. And this was a case report. They improved. At that time, we had a neuroalpha. This was a study that had a number of independent researchers involved in it. Then Lindy Chow, who is a professor at the University of California, San Francisco, did a study that's completely hands-off, independent from us. Now, what she did was she had 8 patients assessed over 12 weeks, 4 in control, 4 in, with the active device. Now, they all improved using the usual, measures. But what she did was she also, because she's also a professor of radiology, she had access to these imaging machines, and found that those who were on the active device actually showed that the activation through the measurement of the cerebral blood flow either maintained or improved over 12 weeks, whereas those who are in the control just continue typically in Alzheimer's disease to decline. So these are the evidence we have. Of course, we hear of acting total and a bunch of things. Now we had a big study going on, and this was completely stymied by the pandemic. So we had to abandon a big study. Now we're going back again, and we got back to pre-submission with the FDA and say, okay, we're going to do it now for mild cognitive impairment and see how that's going to work. So that is something else. We're starting another big study on dementia.
It's exciting. The more papers that come out, the more people that benefit from the more case studies, the more anecdotal reports. It's all very exciting. One thing that I often get asked, and it's something that I personally am conscious of, especially when it comes to Thomas and potentially using photobiomodulation, are the side effects. Are there risks, especially someone who may have an underlying brain imbalance, a brain disorder? What is your take here?
This is an area that people don't explain very well. Generally, the experience with photobiomodulation is that there's very little risk. We have more than 100,000 devices over the years in the market, and no one's come back and say, something fatal. We even did a big clinical trial for COVID-19. Uh-huh. And so our study, in fact, the paper is being reviewed right now, but we already had approval from Health Canada based on the outcome that we've shown, which is a quicker recovery from acute COVID-19. Now, I've got to distinguish this from the long COVID that is a problem today, which we are actually have just started a clinical trial as well. But on acute, we did show quicker recovery from that. But also, what while the control group or people in usual care, out of this, we had 294 subjects. Those are on the normal care. 4 of them had severe hospitalized and 1 died. But those who are on our device, nobody was hospitalized. So that is an indication of, that's minimum side effect. And what the reports we get is when they use the gamma, they get the mind's too busy, and some people don't sleep very well in that day. But that's not big deal. And I say that if you use the gamma, if you use it while you're resting and closing your eyes, there is an increased possibility that your mind gets too busy, because what the device does is shut down one network, the default mode, and move on to the salient, which is more active.
Yeah.
So but the one thing about this side effect thing, photobiomodulation, this has been out for quite a while, but people are not paying attention, is the cells respond to photobiomodulation when they're away from its balance of homeostasis. And they respond better when they're away. But when they're in balance of homeostasis, they don't necessarily respond too much, which is a great thing. And that explains when you're completely healthy and you're at the top of your game, you're just maintaining and there's not much upside. Yes. But you are all stressed out, you'll respond better.
All right, let's go back to Thomas. So his first QEEG scan showed extreme activity in one part of the brain, for instance, right? And all other parts were very depressed. And that's where it was believed that the seizures were originating from. Could you then, if Thomas, for instance, had one of your device or any full head photobiomodulation device, could you assume that it could potentially trigger a seizure because you're taking an already active state, part of the brain, and then overstimulating it? Is that a potential risk?
Okay, I'm going to start with a caveat or say I don't know for sure, but I can chip in. It's going to be a little bit scientific here. Now, what we found that when we did a study using the gamma on healthy brains, we found that we actually increased the amplitude of alpha, beta, gamma, the faster wave, and suppressed, the slow wave, delta theta. Now, what we found was, the other thing we found, we didn't have enough word count space to put it in, is while we actually increased the connectivity of the brain, we found that overall there's inhibition. There's more control for some reason. And I can, with all the work we're doing, I'm finding that as we go beyond 10 years, go beyond, and then the 40 years seems to be like a switch. There is more inhibition for some reason. And that's why I think the scientists at UCSF were finding that there were, with endogenous gamma in the brain, there was more control over the risk of seizure. So that's my take on it. But we haven't done a clinical study specifically for epilepsy, but it's something you can try. With the gamma, you might find that just, based on the literature, that you might be able to control the risk of seizure.
Yeah. So, and I just want to add as well, this isn't, I'm not using this as an opportunity to come up with protocols for my son or anything like that. I have done a call in the past, an interview in the past, and there was an argument put out that you should be careful. You should at least do some scans with the brain before you bring in photobiomodulation because of that potential risk. And I know it, a lot of people heard that and they were a little bit concerned about using, devices like yours or even panels, on the eyes or in the brain. And it's something that obviously a lot of people are asking me about. I don't know the answer, but then I do know that a lot of people have been using your devices, panels, all sorts of other devices, and they're not having seizures or strokes or anything like that. So it's one of the things. It's a question I've wanted to ask you.
Let me just chip in here too. Now, one of the things we never do is pulse visible light. So
Yes.
our pulses are with the near infrared, which is largely invisible. Then when you put it on, you don't see it. There is the rays is actually quite small, but there is, they call the strobe effect.
Yes.
That you keep looking at rhythmic, flickering light, you might have a higher risk of a seizure.
Yeah.
So that's why I never pulse any visible light.
Yeah. So at the end of the day, we're just using, or you're just applying light at a particular wavelength, at a particular irradiance into the nose or into the brain. What separates then your products with, say, one of these large LED panel arrays that's using the same wavelengths?
Okay, I don't want to throw you a bunch of physics, but here's a common sense view of this, LED is radiates out light, all over, right? It's not like lasers where it's collimated. It's you can point and travel for a long, long way. So now, which means that if you have distance between the light source and your target surface, there's bound to be attenuation, a reduce in the power.
Yes.
Now, the further you are, the less power is going to reach the skin or the surface area, right? Okay, that's a simple thing. Now, that's why you see that all of devices have contact. Now, contact initially was a little bit uncomfortable, but over the years we've improved. Now it's very comfortable. We design in such a way that we have contact and you don't feel it. And we measure everything. We don't just actually all the Vielight LEDs are only available to Vielight because we engineer the LEDs ourselves.
Wow.
To achieve the certain power density. Power density is like the concentration of power in one area that you need to achieve an outcome. Now, if you have it too low, okay, let's be open here. A lot of LEDs that people get are off the shelf. Off the shelf LEDs are like 22 to 25 milliwatts, right? And you put in the distance, you end up maybe 5-6 milliwatts per square centimeter and so on. Now, then you ask yourself, is that going to work? I would say, yeah, possibly, because photobiomodulation is, in a way, quite powerful. You can get things to respond. But then the next question to ask is it optimal? Are you getting what you're aiming for? It could be way, way suboptimal. And what I want to say is this, it may be a case where you get better outcomes by just going out into the sunlight. Yes. Where we have measured it, the power density you get out of sun with the full spectrum is much, much higher than a lot of these LEDs that are coming out of these helmets or panel. And ours is more, but if you pulse it, you can use it anytime. That's why there's a lot of difference. It's very hard for me to say, okay, go and say things like that. And then I'm biased because I'm a manufacturer and stuff like that. Okay, but I'm just saying, you apply your common sense, and think about it. Now, panels can work, infrared panels, saunas, and all that, you feel warm and so on because it actually activates the water molecules and you get this energy. But if there are some panels that are pretty good because they have reflectors, they get LEDs, reflectors, so it's more concentrated. It's higher than just simple panel. So watch out for that, because I don't want to disparage some of the manufacturers that come out. But I get really sometimes a little bit upset when the marketing takes over, and just make claims and stuff, and everybody believe and spend a lot of money without being honest about. Or they never measure. We measure everything. Okay, the instruments are really expensive. I measure our stuff. I know James Carroll measures his stuff. We invest money in doing that, so we know what we're getting. Now, I talk about real-time imaging done at Baycrest Hospital. I'm telling you, when we get this huge response from the brain, it's not coming out of 5 milliwatts, 6 milliwatts. It's coming out of about 100 milliwatts per
Yeah, right.
square centimeter, and from lasers. So
Mm.
we have to have that kind of thing to achieve, some kind of optimal. We're still doing the study. We've got 20 cases, but it takes like, uh, to image somebody and do to all the work, it takes about a whole day. So it takes a lot of time. Yeah.
So what are your products? What sort of power density are they putting out? Is it 30 milliwatts or thereabouts?
We have, okay, the nose is about 9
Mhm.
to the radiance on the surface, 9 milliwatts. And I found that this is, now we didn't think about that initially. We calculated, based on what laser was achieving, so on. But in this imaging that we did, it seems to be perfect.
Mhm.
9 milliwatts at 810 nanometers, passing at 10 hertz gives you the biggest, the biggest and outcomes in the imaging. Then we have the all in the head. We at the moment our diodes are putting 75 milliwatts here, 100 at the top, and the new Neuro 4 at the back is in 50. Now I can go up to 150 milliwatts, but that is, I'm trying to see, okay, should I do it because I'm a little bit concerned about safety, and I want to be able to match people going out to the sun, and because we either created or evolved to be able to tolerate a certain amount of energy from the sun. So I'm trying to match that. But I would say that the imaging we're doing actually requires, coincidentally, that kind of power to achieve optimum response from the brain.
Yeah, that's cool. It's cool that you're quantifying it and seeing the change and then reverse, looking backwards from that rather than just coming up with a formula saying we're going to use 50 milliwatts for 10 minutes and put out X amount of joules and there we go.
Or go out there and buy an LED off the shelf, and just do it.
Yeah.
Because that's what they do for just commercial LEDs.
Yeah, I have a spectrometer and I do a lot of just testing panels and that. And yeah, some of the numbers are. So I literally was reviewing one before this call, and the numbers weren't even close to what was marketed. And you see companies coming out saying the most powerful panel and that. But then that leads me into this next question. So you've kind of answered already, but I'm curious to get a few more thoughts on it. Do you think there is an upper limit? You mentioned before a lower limit, like if there's not enough power, we're not going to get it.
I'll share with you what we saw in the imaging. So we got peak of say 100, 150 milliwatts, but as the power increased, we were using laser in the big scanner, we can't use LEDs. When you move past 200 to 250 milliwatts, it became negative.
Yes.
So that is the limit. And it goes well with the literature and the research over the years where in photobiomodulation, we say that's a biphasic response. Too little, nothing's happening. Too much, you can get overdose. And you might relate this to the mechanism. Okay, I'm sorry, I'm going a little bit of science here. Now, part of the process of photobiomodulation is you release free radicals, reactive oxygen species. While you're doing that, your body is also neutralizing it with something called the superoxide dismutase and so on. But if you produce too much, your body is not able to neutralize it fast enough, so you accumulate free radicals, and that could be the reason why you get negative when you put too much the energy dose into the brain or the body.
Yeah, it's a fascinating one, and it's something I'm often asked, like, okay, if we're using this particular product for 10 minutes, can we double the power density and use it for 5 minutes? And it seems to not be as simple, not be as black and white as that.
Yeah, so I do something that's kind of non-intuitive. When people respond well, they tend to do more, which is kind of, what you think is the right thing. Actually, you should do less. Yeah. Because when you are responding positively, you have that kind of energy that's enough to do that. As you do more, we just talked about it, you go into a territory of negative response because too much dose and you're creating too much free radicals. So when you're improving, significantly cut back. You just cut back.
It's a good way. It's a good idea. Two quick questions to finish up. Firstly, your personal protocol. What do you do on a day-to-day basis or a week-to-week basis in regards to photobiomodulation?
As you know, I have an array of devices, and I usually put them when I go to bed because they're on my shelf. It is okay. I haven't done it the whole day. I just put it on, and I actually sleep with the devices because they shut off automatically.
Right.
Now, the thing is, people report about being too busy. I don't personally. I don't find that to be a problem. I just go to bed and shuts off automatically, and in the course of sleeping or whether I would just figure it's become a habit. I just remove it. I can do it during the day. Sometimes I want to believe my own protocol that I recommend to people, that you do like a gamma before an event, 30 minutes to half to an hour. And I think it's working. I'm not very sensitive to light. We're doing a meditation study with the Neuro Pro, and do a strip with different frequencies. The outcomes are really quite remarkable. I'm just quite shocked at how we can when we induce a certain frequency, they can go into a altered state, like a bliss state, or whatever you call it. But I'm not sensitive like that, and I trust that this is working on my brain, and I continue to be sharp, and I think it's working on me over time.
Yeah, totally. So, and then the last question I have is, can you give me a quick rundown on the products you're selling? Because I'll be straight up, I've used your products a couple of years ago. I don't know what it was, the Neuro, I think it was, and the intranasal device. Obviously now there's totally new products out there.
Yeah.
And when you go on your website, it's a bit...
Yeah, I don't know what you mean.
Where it's what's suited for what? What's the key differences?
I gotta say that the problem is, like, we cannot give you a menu and say, okay, use this product to treat that, because the regulations don't allow us to make stuff like that. So hopefully the people get educated, and some people know what they're doing and look for. But I have here. So this is the intranasal. I don't know if you've got the latest, which is called the MIP.
Yeah.
Okay, MIP. Now they still look the same over the years, but we had one before, red and so on, and then we had the near infrared. Now the MIP you can put two at the same time. We have 4 different applicators now, from red LED to red laser to the near infrared, which is the 810, and blue. Yeah. And we introduced blue because blue is antimicrobial. It can help, kill bacteria and viruses. It's not something that I pull off the air. It is something that's already proven. So when I turn on, I can have both in my nose, a blue and a red. Okay. Now, this little thing which run on a AA battery is intelligent. Now, if you put I'm not here, the 810, 810 on the Neuros, you can switch between 10 hertz and 40 hertz, right? Alpha and gamma. This one, all you do is it senses all the different applicators in, and when you sense, and then it delivers the right power. Now, when you connect the 810, which is the same as for the Neuros, it recognizes the Neuros, and when you keep your finger on the button, it can switch between 10 hertz and 40 hertz. So there is intelligence in this little thing. It's very portable. It's actually very popular with the athletes because it's just put in the pocket, Yeah, that is. I showed you the Neuro already, version 4, and we have. This is the device that we use in a clinical trial for COVID-19. Yeah, it has. So this actually goes on the sternum above the thymus gland. It helps to release the T cells and helps to improve the immune system. In the meantime, when you have advanced COVID, it helps to heal, produces nitric oxide and so on. It also have an intranasal for the nose, of red, which helps to release. When you have red acting on the cells, it helps release nitric oxide. Nitric oxide helps to inhibit the replication of coronaviruses. So that's very briefly why we think it works. Then we have other devices that are not released yet, so no point in showing. We have a pain device for focal pain treatment, and also a vagus nerve stimulation device too.
Really?
Yeah, we have one. We're testing that one right now.
All right, that is really cool. Yeah, because I know when you head over to the website, you've got your Neuro X Plus, you've got your Neuro Pro, the Neuro 3, which will soon be the Neuro 4. And yeah, everyone's slightly different. So look, I suppose if someone's keen to get something and they need clarification, should they just reach out to your team?
Yeah. Just give there is chat, and there is there's a customer service line. Just call it, and I think they're happy to help. Yeah.
Hey, Dr. Lim, I'm super appreciative of all your time. I said we'd do 30 minutes max, and it's been well and truly over that. And we didn't even get into a lot of the scientific questions that I have, but I'm super keen. Hopefully we can do another call, when our calendars and schedules aren't quite as busy, and we can dive into some of those other questions. And by then I would have been using some of your more newer devices. So I'll have some personal insights as well. So I'm excited to have a play around.
Great.
So again, thank you so much for your time. I appreciate you taking the time away from your family. If there's any last things you want to mention, or website or a personal blog or books or anything like that, feel free to share it with the audience.
Well, thank you for the interview. I've been, I got constant requests to write a book. I don't do it because things change so quickly, So for sure, I'm not going to do a print, but maybe soft. But I'm so engaged in research and writing papers that takes my priority. I've got a few going on now. Like I said, I am now, our COVID-19 paper is under review. So I've got, I got to respond to the reviews questions. And we got like I mentioned, this Raman spectroscopy paper that's being done right now. I've got a request to a couple of other papers. So that is the fun stuff for me. I'll be quite busy doing scientific papers and doing research. But just I think the company sends out newsletters and updates on the website. And sometimes I don't know what gets put out there because I trust the team to do those stuff.
You have a really good website in terms of the knowledge base, the resources you have there. I follow your newsletter. Whenever there's a new study or a new article referencing a study, I share that in my monthly red light therapy news video I do. But whenever someone comes to me with a question around photobiomodulation and a brain disorder, I mean, that's well above my pay grade. So I typically just send them straight to your site and know that they're going to be in good hands. So that's why I am super keen to personally play around with some of these products. I shouldn't say play because they're not a toy. They're very serious technology and changing a lot of people's lives. But I'm also
you're not going to get hurt, so experiment.
Yeah, that's true. I'll wear it all day and see what happens after 24 hours of straight use. No, I wouldn't do that. But yeah, we'll definitely do a follow-up conversation in a few months, and we can go into some more of those technical questions. And I'm sure we'll cross paths maybe at a conference or something in the near future as well. So I look forward to that day. So thank you again. Enjoy your scientific review papers and your time in Australia.
Great. Thank you. They're waiting for me for lunch. So it's a good time.
Thank you so much. I really do appreciate that.
Bye. Yeah. Bye.
And that is a wrap. If you've got any questions or comments, please leave them below. I'll also put all the notes and links to resources mentioned in this interview, all of that will be below. But be sure to hit subscribe because I do have some of the new Vielight products, so I am going to be testing them and sharing those reviews on this channel. And like I said earlier, I am going to do a round 2 with Dr. Lim, and in that interview, we will go more into the science. Now, if you enjoyed this video, be sure to check out this playlist. Here I have an assortment of interviews I've done with researchers, company founders, and other passionate red light therapy experts.